I think developmental behavioral pediatrics is the best specialty. I see amazing, fascinating kids. I work with amazing families. A general pediatrician will definitely follow a child's development, but I get to go a step further. I get to spend more time with them and play and interact with them. And I really get to assess their abilities and their strengths and their weaknesses. And then I counsel families about specific diagnoses, treatments, therapies, and sometimes medications. I am honored to be called an Army brat and an Air Force veteran. I've lived all over the country and in Europe because my dad was in the Army and I was in the Air Force. Because of the military lifestyle, my childhood was truly an adventure. And despite all the transitions and the moves and being in 9 different schools before I graduated from Evans High School in Evans, Georgia, I knew from an early age that God was calling me to be a pediatrician. I graduated from the University of Virginia with a bachelor's in biology. And through the Air Force, I was able to graduate from the University of Florida Medical School in Gainesville, Florida. And then I was off to Wright-Patterson Air Force Base in Dayton, Ohio for my 3-year pediatric residency. And as an Air Force officer and a pediatrician, I was able to continue my travels, meet wonderful military families, and work with some of the best colleagues in the world. I was a pediatrician in England at RAF Lakenheath, where I met my husband. I was also chief of pediatrics at 2 Air Force bases, Nellis Air Force Base, and right here at Barksdale Air Force Base. And then being selected for a 3-year developmental behavioral pediatrics fellowship at Madigan Army Medical Center in Washington State was truly a dream come true for me. My patient philosophy is a team approach to helping the child. I am part of the team, but also the child's parent, the child's pediatrician, therapist, early intervention specialists, the teachers. We're all part of the team helping the child to reach their full potential. I have a family with 4 kids and a wonderful husband. We have 2 that we adopted as infants. We homeschool, so that keeps me extremely busy. I think because of the adoptions and because of homeschooling, there's a lot of different viewpoints and understanding that I have in different family situations that can be helpful in developmental and behavioral pediatrics. I've always been told that one of my strengths is listening to people and observing. So I want my patients' families to know that whatever they can share with me, whatever they can tell me about their child, that is how I'm going to be able to help their child reach their fullest potential. I love children. I've always loved children. I love to work with them. I love interacting with them. A lot of times in developmental pediatrics, I'll be on the floor with them, playing, seeing how they're interacting, and just looking for their abilities. I would say that just celebrating their small, what might seem to somebody else insignificant triumphs and progress is important. I want to be able to help the family, help the child, and to know that there's progress being made.